One of the greatest unknowns 3 years ago was the COVID-19 virus. The world has changed a lot since then, but healthcare providers are still facing challenges and having to adapt. Crystal Quao gets a glimpse of some of the lasting changes and impact it's had on a rural hospital since then.
Dustin Hager, a physician assistant at the Heart of America Medical Center, says he remembers not knowing what the medical community was up against.
We were hopeful that this was going to, the virus would burn itself out, or the virus would move through the population at a quick pace and it would be done quickly.
Of the 36 rural hospitals in North Dakota, there hasn't been any closures since the beginning of the pandemic.
To the hospital.
Eric Christensen, the CEO at the hospital in Rugby, says in the post-pandemic world, the biggest change has been the attitude towards healthcare.
There was a lot of talk about, we don't need all these hospitals, there's too many hospitals, too many hospital beds. When COVID came, we didn't have enough hospital beds.
Hospitals were short on healthcare professionals then, and it continues to plague clinics and nursing homes. Christensen says 15% of geriatric nurses left the industry.
Environmental services, housekeepers, folks that want to clean the facility, kitchen staff. I mean, we're finding that there's a struggle across the entire healthcare system.
Some of the custodians haven't returned, and hospital officials say it's been a challenge to fill those positions.
A lot of places are, they have staffed beds, they have more licensed beds, but they can't fill all of them because they don't have enough staff.
Hager says before, during, and after the worst of COVID, he sees his role as an educator, so patients can make informed decisions about their treatment.
It's hard. There's a lot of regulations. You're held to a very high standard, but in my mind there's nothing more rewarding than helping your friends and neighbors who are sick or ill.
He says he's seen the rates of child care and preventative care visits begin to rise again. In Rugby, I'm Crystal Quao, reporting for your news leader.
As far as telehealth services go, Christensen says rural health clinics are currently under-reimbursed, but there is a national push to raise it.